Hey everyone, this is Dr. David Clark. We just finished Module 1 of the Neurochemistry course, the Clinical Neurochemistry and Nutrition class. And basically what we covered this module was what I call core principles, which may not be exactly what you think. I covered my principles for how I view treating patients, kind of my guiding principles for choosing when to use neurology, when to use nutrition. And I think everyone here kind of opened their eyes about a way you can implement these things that make sense using both models, because you don't really have to pick sides or choose one or the other. You can integrate it. And that's really what this weekend was a lot of understanding conceptually how the brain works, how neurons work. We really didn't spend a lot of time memorizing, receptor types, memorizing different genes. The goal of the weekend was to help people understand basically that you've got a blood-brain barrier, what it does, ions, lots of general concepts. But we also, for sure, did clinical applications. We showed a lot of videos of actual patients and talked about how to analyze their history and look for neurological factors and metabolic factors. We talked about how to recognize that in an exam. And then we started talking about specifically conditions such as epilepsy, seizure. We also talked some about migraine specifically. And for the rest of the course, we're going to be hitting next module what I call the 4 metabolic priorities, which I'm not going to tell you about right now. You got to come to learn those. But we're talking about how those are the guiding principles on what to look for in these patients so that you don't get lost, so that you know, what do I do? What do I do if it doesn't work? And what is the next thing I should be looking for? We're going to be talking about also in a module after that, a module on systems neurochemistry, which is we look specifically, for example, at the vestibular system, the musculoskeletal system, the basal ganglia, again with lots of application to real patients, analyzing histories, learning what to do. We're also going to be doing a module after that on neuroinflammation in general, and we're going to be talking about a lot of cases, talking about complex regional pain syndrome, autism, oh my gosh, TBI. Then we're going to do a module on neurodegeneration specifically and talk again about TBI, talk about concussion, Alzheimer's, Parkinson's disease, Huntington's disease, ALS, so that you'll be able to have a nice wide understanding of what you can do with this information on a daily basis. So it's also about not just sitting in class and looking at notes and graphs, but understanding what are you going to do with it when you see the patient. So Module 6 is that. Module 6 is complete integration of everything we've already done. It's tons of analyzing cases, figuring out a treatment plan, knowing if it's going to work, what are our markers to determine if it's not going to work, so that you feel totally confident no matter what walks in the door. So I hope you're able to join us for the rest of the modules live, or at least join it on demand. So hope to see you there.